Hi everyone, my name's Allison Montagna and I chose to do my final project on RSV. So let's start with a case study. Bella is a 5-month-old Caucasian female who was born in October. She weighs 16 pounds and she has 2 older brothers, ages 3 and 6. She was brought into the emergency room for an increase in respiratory effort and fever. She is now on the pediatric unit. According to her parents, she has only been sleeping 2 to 4 hours each night. Bella goes to daycare at least 3 days a week because both parents work full-time and they have had to recently take days off in order to be with Bella while she has been sick. Her mother currently has a cold and her father just got over a cold. Her mother is also a current smoker. Bella was born prematurely at 30 weeks. She has been receiving Synagis, but missed this season as her parents had to cancel her appointment and forgot to reschedule. Bella appears lethargic. She's clearly in respiratory distress, and she has had about 3 wet diapers each day for 3 days, according to her mother. She's tachypnic as her respirations are 85 breaths per minute. She's tachycardic. Her heart rate is 130 beats per minute. She's intercostal retractions and nasal flaring. She has a temperature of 101.2 degrees Fahrenheit. She has a runny nose and lack of appetite. Her BUN is 18. Her sodium is 145. Her pH is 7.32. Her PaO2 is 60. Her carbon dioxide is 40. And her sodium bicarb is 28. Here is a short video clip on the pathophysiology of RSV before I really start to get into it on the next few slides.
RSV bronchiolitis is a serious threat to the health of infants and young children. Based on historical estimates, it is the leading cause of infant hospitalization as well as the leading cause of infant viral death. RSV lower respiratory tract infections lead to epithelial necrosis. With the loss of ciliated cells, smooth muscle constriction of the airways, goblet cell proliferation with increased mucus production, and parabronchiolar inflammation and edema. As a result, pulmonary function during RSV lower respiratory tract infections may be significantly compromised, leading to difficulty breathing and decreased systemic oxygenation.
So, before we get into the actual pathophysiology of RSV, I just wanted to mention that I'll be relating to this case to the nursing theorist Virginia Henderson and her 14 components. Now, already there are some alterations in the 14 components according to this case study. Breathing, being able to eat and drink adequately, eliminating body waste, and moving, maintaining desirable postures, sleep and rest, and thermoregulation. RSV is a paramyxovirus containing a negative single strand of RNA. There are 2 subtypes, A, and B. RSV infection first begins with the replication of the virus in the nasopharynx. It is caused from an infected individual or surface, and it spreads through the lower airways, eventually reaching the terminal bronchioles. A consequence of this replication includes sloughing of necrotic epithelial cells, which exposes dense subepithelial network of nerve fibers and forms the afferent limb for the cough reflex. It activates a subset of transcription factors and proteins which control the expression of pro-inflammatory and immunological mediators. The initial influx of neutrophils into the airways is rapidly replaced by predominantly lymphomononuclear infiltration and increased microvascular permeability. This leads to submucosal edema and swelling. The mucosa increases mucus production, epithelial damage, and eventual necrosis. Mucus secretions begin to increase in quantity and viscosity, leading to pooling from the loss of ciliated epithelium and results in widespread mucus plugging. Next, the acute inflammatory changes from the immediate response to viral replication in the bronchioles leads to airway obstruction and air trapping, which causes the classic clinical triad of wheezing, atelectasis, and bilateral hyperinflation. The severity of RSV and duration are primarily a function of the immune response of the host. The immune mechanisms provide the respiratory tract with the first barrier against the establishment of a productive infection. The specific humoral and cell-mediated immunity play a critical role in clearing the infection and its course. This response doesn't result in complete protection against subsequent infection. It decreases the severity. In infants, high titers of maternally derived RSV neutralizing antibodies are associated with a much lower risk of hospitalizations due to RSV. This effect can be replaced or enhanced in high-risk infants by passive prophylaxis. Cytotoxic T lymphocytes are central in the control of active infection and viral clearance. Immunocompromised individuals with deficient cell-mediated immunity experience more severe and prolonged RSV disease and shed the virus much longer. So, when diagnosing RSV, it's really just a matter of clinical evaluation, just how the patient appears with, are they having nasal flaring, temperature, increase in effort to breathe, and it also can be diagnosed through rapid antigen tests using nasal washings or swabs. The treatment for RSV is supportive. There is one medication that will treat it, but it isn't really being used anymore. So when a child or when an individual is diagnosed with RSV, the healthcare providers just try to treat the symptoms of it. So Bella would be placed in contact precautions, and healthcare providers would be wearing gowns, gloves, and masks to prevent circulation in the hospital. Medications to help treat Bella's symptoms would be Tylenol for her fever or IV fluids to help treat her dehydration. Because remember, according to her mother, Bella hasn't really been eating or drinking normal, and she has only had 3 wet diapers each day for the past 3 days. Continuous infusion of normal saline is started to help improve her perfusion and help increase her urinary output. An isotretinoin solution was selected because her sodium level was 145, so her fluid lost was similar to the sodium concentration in her blood. This is why she was given normal saline. Another medication that I mentioned that could be given would be Tylenol, 2.5 milliliters, which is based off of her weight of 16 pounds. Tylenol inhibits the prostaglandin synthesis and has an antipyretic effect. Other treatment or assessments for Bella would be frequent respiratory assessments, suctioning if needed, oxygen therapy if needed, and repositioning her so that she is to promote the best breathing that she can by just repositioning her. Also, bonding is needed between Bella and her parents for proper development according to Erikson's stage of trust versus mistrust. The medication that I was talking about before that was approved to treat RSV is ribavirin. It is a broad-spectrum antiviral agent most widely studied in hospitalized children and is currently the only FDA-approved drug to treat RSV infections, even though it is not really being used anymore. It inhibits viral DNA and RNA synthesis and subsequent replication. Aerosolized ribavirin is preferred in order to minimize the systemic adverse effects, such as hepatotoxicity and nephrotoxicity. Despite the lack of well-designed studies, current evidence suggests that aerosolized ribavirin can potentially prevent RSV-associated lower respiratory tract infections. The utilization of ribavirin is limited by administration challenges related to its teratogenic effects and potential for environmental spread. In order to minimize secondary exposure to neighboring patients and healthcare professionals, ribavirin should be administered in a well-ventilated room. Next medication is called Respigam, and this is a medication to prophylactically prevent RSV. It contains a polyclonal antibody to RSV and was made from donors who have high serum titers of neutralizing antibodies to RSV. It was licensed in 1996 by the FDA for prophylaxis of severe lower respiratory tract disease in children younger than 2 years of age who are at high risk. It typically was administered once a month during RSV season. It has been shown to prevent or reduce RSV disease severity in infants and young children who were exposed to the virus after administration. It was not recommended for infants with cyanotic congenital heart disease as it was associated with an excess of adverse events in this population during testing. It is no longer available, and it has been replaced by a medication I will discuss on the next slide. And that medication is Synagis, and that was what Bella was supposed to be administered, but she missed her appointment. So Synagis is a monoclonal antibody that was licensed by the FDA in 1998. It consists of 95% human amino acids and 5% mouse amino acids and was completely engineered in a laboratory. This antibody binds to the F protein of the virus and is active against A and B viral strains. It blocks the fusion of the virus to the host epithelial cell. Guidelines recommend that a maximum of 5 doses which would be 15 milligrams per kilogram intramuscularly every 30 days to be administered during the RSV season. Efficacy is similar to that of RSV immune globulin intravenous, but it doesn't prevent otitis media or hospitalizations for other respiratory viruses. Infants such as Bella, who are 32 weeks and 0 days gestational age to 34 weeks and 6 days at birth, and younger than 3 months of age at the start of the RSV season, either attend daycare or has a sibling younger than 5 years of age, which Bella does. Remember, her older brother is 3 years old, may receive a maximum of 3 monthly doses so that they are protected when they are at greatest risk for hospitalization. So Bella falls under this category. Remember, it is not effective in treating RSV disease or licensed for treatment of infection. It's just a prophylactic medication that should be continued even if a child experiences a breakthrough RSV infection during the season. Some infants have been hospitalized more than once in a season for RSV lower respiratory tract infections, and there are multiple RSV strains that may circulate during the same season. So, getting into some of the concepts that relate to this case study, firstly would be infection, of course. An infection is the invasion of microorganisms of the body tissues that may just be localized or may affect the entire body because the immune system is unable to fight off the pathogens. Our body's immune systems work hard to fight off the pathogens from bacteria, viruses, and other hosts so that we don't develop an infection. If an infection isn't treated properly or fails treatment, it may infect other individuals. Certain infections may be prevented through thorough hand washing, keeping up with immunizations, and RSV falls under this concept as it is acquired from an infected individual or infected surface, and it may lead to other respiratory infections. Another concept is family dynamics. According to Giddens, family dynamics is defined as interrelationships between and among individual family members or the forces at work within a family that produce particular behaviors or symptoms. Dynamics in a family may be either supportive or destructive, and nurturing or damaging. Family dynamics aren't just between parents and children, but may be between children to children in the case of Bella and her family. Age needs to be taken into consideration in the case of family dynamics, as younger individuals may have different ideas and views than their elders, and vice versa. There are certain situations in where family dynamics may be affected, such as family expansion or certain illnesses, addiction, and how a family handles the situations affects their relationships and family dynamics for the better or worse. So in this case, Bella's illness is affecting her parents' relationships with the other children as they feel as though they are not getting enough attention, and this may cause Bella's older brothers to resent her. Getting adequate or inadequate sleep can affect multiple aspects of an individual's life, including physiological, psychosocial, and psychological. Adequate sleep affects metabolic regulation and the body's ability to fight off infections. There are 5 stages of sleep, which includes 4 states of non-rapid eye movement sleep and 1 stage of rapid eye movement sleep. And it is clear that Bella is not is probably not getting enough sleep because, according to her mother and father, she has only been able to sleep 3 to 4 hours each night, and this due to her coughing, an increase in an effort to breathe. And this not only affects Bella's sleep, but also affects her parents' sleep as well, as they, I'm sure, are up with her every night while she is not sleeping well. I see a few psychosocial issues in this case study. First, the parents are focusing on the ill child, who is Bella, and not necessarily focusing on the other two healthy children. This, as mentioned before, may cause resentment of the younger child by her older brothers. Another issue may be is that the parents may feel guilty that their child got sick. They may feel guilty that they have to send Bella to daycare and that they can't stay home with her, to try and help prevent these infections from occurring. There is an issue for financial concern for all of the sick visits and for this hospitalization, as we all know, healthcare is not cheap. The whole illness with Bella may cause regression in the boys. They may start wetting their pants again or reverting back to using a bottle from all of this stress that they're under from their sick sister. So, as I mentioned before, the nursing theorist that I want to relate to this case study is Virginia Henderson's need theory. Her definition of nursing is the unique function of the nurse is to assist the individual, sick or well, in the performance of those activities contributing to health or its recovery that he would perform unaided if he had the necessary strength, ill, or knowledge, and to do this in such a way as to help him gain independence as rapidly as possible. She also mentioned that in order to help a patient get to the point of being able to perform certain activities at home back, individually again, that nurses must get inside the skin of each patient to know his or her individual needs. And there are 4 major components to Henderson's theory that include the patient, nursing, health, and the environment. She described 14 activities and basic need components to assist in providing a patient with independence. They are being able to breathe normally, which Bella cannot, eat and drink adequately, which Bella isn't, eliminate body waste, she is not doing that either, move and maintain desirable postures, as much as she can as a 5-month-old. I'm sure she's not maintaining proper posture to be able to breathe as efficiently as she could. She's not getting adequate sleep and rest. Being able to, select suitable clothes, dressing and undressing, doesn't really relate to her as she's only 5 months old. Number 7 does relate to Bella, however, being able to maintain a body temperature within normal range. And remember, her temperature was 101.2 degrees, and she was given Tylenol to decrease her temperature. The rest don't really apply to her. Keeping the body clean and well-groomed, avoiding dangers in the environment, communication with others, and expressing emotions. I believe Bella could still do this even though she is only 5 months old. She is able to communicate with her parents, be able to communicate her needs. Worshipping according to one's faith, working in such a way there's a sense of accomplishment, play, or learn, discover, satisfy curiosity. And as I said, not all of these relate to Bella, only a couple do, but I still feel that this theory is extremely important in this case. The nursing diagnosis are listed in priority in relation to how the 14 activities and components of Henderson's need theory are listed. So the first one is an ineffective breathing pattern related to increased consolidation secondary to infection, as evidenced by tachypnea and increased work to breathe. So, when assessing a patient, the airway is always most important, and in the case of Bella, her airway and breathing were compromised due to the RSV. So that is why her breathing difficulty is listed first in the diagnosis. Being able to breathe normally is Henderson's number one 14 Henderson's number one of 14 activities necessary to help provide independence and a basic need for life. The plan of care for Bella involved firstly trying to improve her breathing with suctioning if needed and oxygen if needed. The fact that Bella is having difficulty breathing is one of the major concerns and is something that healthcare providers would want her to be able to perform on her own without getting short of breath or requiring oxygen at home. Impaired gas exchange as related to atelectasis as manifested by abnormal arterial blood gases that was listed in the beginning, and a decrease in the oxygen saturation. And finally, hyperthermia related to inflammatory and disease process as manifested by her elevated temperature and warm skin. In addition to the three diagnoses listed, family-centered care is also extremely important in Bella's plan of care, especially since she is only 5 months old. As a child, she needs the support from her family to become better and independent in the activities of daily living again as much as she can as a 5-month-old. Being able to breathe adequately, body elimination, thermoregulation, and eating and drinking adequately. There is some education that needs to be provided to her parents to help prevent RSV from occurring again. The mother needs to be encouraged to stop smoking or at least not smoke in the home. Try, and this is a difficult one, to try to keep Bella home from daycare if at all possible, just while she is, healing and trying to get better, and not send her back to daycare right away just to chance that she might contract RSV again. Hand washing is extremely important, and educating them to seek medical attention for any worsening symptoms. If she's having nasal flaring again, if her breathing becomes worse, she's having retractions again, just anything that does not seem to be getting better. So that's my presentation for you guys. Thank you so much for listening. And here is a list of my references. Thank you guys so much.